Sitting is today's smoking. That's a quote that is used in today's medical community, and the reason why is because people are sitting so much. It actually contributes to problems like low back pain, cardiovascular problems, and more. Mike, you want to add in?
Including hip pain, which can be very stiff hips, and if you have limited mobility, it's going to affect your lifestyle and what you can actually do.
So first, we're going to show you why and how sitting makes your hips stiff.
Stips! And then we're going to get into
your hips stiff, and then, Mike, what are we going to show them?
We're going to get into 5 simple stretches you can do to help solve this problem.
But before we go any further, I'm going to learn how to speak, and then we'll carry on with this video.
Stiff hips.
Okay, we're going to use Sam here to show you how these muscles get tight, why they get tight, and then why we're showing you this, or how the stretches actually correct the problem. So in the seated position, the hip is flexed at 90 degrees. So here we have the hip flexed at 90 degrees with Sam. Now this red kinesio tape, it happens to be rock tape. We just have that handy in the studio. These muscles will actually tighten up because that's the position, the seated position is for such a long time. Now, when this person stands up, let's look what happens after the muscle tightens up. We're going to focus right here. When you stand, you can see the muscle actually stretches and is pulling, and that can rotate the pelvis forward, as well as some of the muscle fibers go to the low back, and they pull and can hyper or put stressful extension forces on the low back. Either way, we have this rotational and these forces on the low back because of this tight hip muscle group. It's the iliopsoas. You don't have to remember that. But there's one more particular muscle that has the same type of problem that is oftentimes forgotten about with the stretch, and we do not forget that with our program, and that is the rectus femoris muscle. It's a long muscle from the ilium, the iliac crest. They call it the ASIS. We won't get into that. It goes down across. It's actually one of your
quad muscles.
Quad muscles. Thank you, Mike. Now, that muscle also tightens up when in the seated position, and then when you stand, you can see it pulls out here on the ASIS that we mentioned, and that also rotates the pelvis in a position we really don't want to have it in. So stretch out these two muscles and you can take that force off the back and the hips, and life is much better. So let's get to it. Good job, Sam. Thank you for not saying anything, Mike, except for what you did. All right, we're going to show 5 hip stretches. Doesn't mean you have to do all 5, but I really want you to try all 5. And you're going to find which hip is tight and which actually feels good. If any of these create any sharp pain, it is a red flag. Do not do it. There's something wrong with your hip, or it might be how you do the stretch. But these should create no sharp pain. Do not do them if they do. The first one I'm going to show in a seated position. Now, this particular stretch I'm showing does not specifically stretch the hip flexors, but it's a critically important and easy stretch to do. I call it the seated figure 4. So you just put your ankle up here and you stretch down like this. Easy to do it, only takes 10 to 15 seconds. You can do it lying down in bed as well, just like Mike is doing. You want to do it the other leg? Yeah,
I can switch legs.
Then you can see the knee. There you go. All right, now we're going to go directly from this into a hip flexor stretch that you can do off the edge of a couch or bed. Go ahead, Mike, seeing how I took all of your talking time before. I apologize for being rude.
So a simple way to do this that's not as aggressive is just to go to the edge of your bed like this and drop it off to the side. You might have to scoot over a little bit to get more of a stretch. And then notice if my leg is straight, I'm not feeling much. Once I start bending my knee a little bit, obviously I'm limited by the height of this mat, you start to get that rectus femoris muscle we talked about a little bit as well. But you can just kind of hang out here. If this doesn't feel like a good enough stretch, we're going to show other variations later you can try.
Right, we've got a really good stretch that Rick Olderman, the expert in this field, shows and recommends. So that's coming up. Let's go to the next one. All right, let's go into Rick Olderman's stretch. This is probably the best way to cover the hip stretch. Go ahead, Mike.
So you're going to have to go to the edge of a bed if your bed is firm enough on the side. You can certainly do this on a countertop or kitchen table if you're comfortable getting on those surfaces. So you're going to begin in a double knee to chest position like this. The closer my butt is to the mat, the more stretch I will feel. So I'm going to...
You mean the edge of the mat, right?
The edge of the mat. What did I say?
Bed.
Or bed. So what you're going to do is bring down one leg, and I'm going to try to bend my knee again to work the rectus femoris. And with the opposite leg, you'll kind of see I'm going to make sure to bring it up towards my chest. You can see I got a little bit of tightness as I pull up. My leg wants to pop up. That's how you get a good stretch here. Try to hold it for roughly 30 seconds. Make sure to breathe while doing this. Another thing that's important to focus on is keeping your leg straight. Don't let it try to deviate out to the side like this. Once you hit 30 seconds, reset in this position and then switch sides. You may notice a difference with this stretch. One leg gets down further or knee bends more, and just maybe spend a little more time on the tighter side.
That's right. Can you go back to the other side, Mike? I just want to help our viewers recognize when you're in this position, when the knee goes down, oops, sorry guys, when the knee goes down, we're getting the deep muscle. That's the one we talked about right here. That's in deep. And that one's hard to get at, but this one right here, that long muscle, which is oftentimes forgot about with most hip stretches, when you pull the foot underneath, that's when that muscle gets stretched, and you will feel that stretch all the way down. It's very clear when you do it. Now, this next stretch is a really good stretch. I know Bob likes to do it. Mike likes to do it. I've done it, and I actually really like it, but doesn't fit into my, I don't have a couch in my basement where I work out. But this is really aggressive, but it's for a little more mobile people who don't mind getting on their knees. Mike, show them what it's done.
So this is commonly called the couch stretch. Oftentimes you do this on the side of your couch. We don't have one here, so we're just using a chair. I like to have something soft to kneel on. Once you're in this kneeling position, get your foot up on the side of the couch. I don't like to do the couch cushions because my ankle is in a different position. If you're actually on the edge, it's going to put your ankle in the plantar flex position. So you're going to feel a slightly different stretch depending upon how you do this. Now, once you're here, some people might feel super tight just right here bending forward. That's fine. Just stay here. What you want to try to do is eventually get to a straightened up position with a good trunk, and make sure that your pelvis is straight as well, because some people might be straight up, but look at, I'm flexing. I'm not feeling a stretch at all. So get a good stretch in there. Once you can do this comfortably, you can kind of noodle around to see which area you're limited on. You can even go back more to get that rectus fem. Just kind of sit in the stretch for a little bit. Oftentimes it feels pretty good.
Yeah, it really does. I enjoy doing it, and it really gets at the hip and that rectus that we talked about. Good, and then do both legs, I'm assuming.
Do both legs, do 30 seconds. I like to do 2 sets of 30 seconds because the first set, I'm normally tighter. The second set, I limbered up a little bit, and I can get a little bit more aggressive with it.
Make sure you use a pillow or a pad, or you have some good carpet, because it is aggressive on the bottom knee.
And the last stretch is a classic one from gym class, at least in my era, or even football, is the standing quad stretch. So you have to be standing. If you feel unbalanced, you can certainly do this by a countertop. Simply grab your ankle and then pull back. Make sure your leg isn't way forward like this. We're not doing the chicken wing or something. So get a nice position, stand up tall. The more you bend your knee, the more stretch you will feel.
Right. This is one I like to do because when I'm going to go for a jog outside, I don't have anything to do it with, but a nice standing stretch. And again, not this, up tall, use something for balance if you need, and then you really get the quadratus. Watch my knee right here. I don't feel a stretch. Whoa, now I feel a stretch, so I'm going to go back to there without this up tall, really critical. Easy stretch to do if you feel like it works well for you. Go ahead, make sure you do both legs. All right, 5 stretches for that hip flexor group. Taking away all that tightness developed from sitting long-term at the computer, in the car, wherever you sit. We have anything else to go along with this?
I would say try all 5 of them out and then see which ones you need to work on more. Perform them 2 to 3 sets a day and hold for 30 seconds each time.
That's right. And we're going to show you one extra little thing. If you happen to have a massage gun, you can use that effectively to get this muscle group stretched out. Hold on. All right, so like I mentioned, you can use a massage gun if you want to get at these muscles and get in there to help loosen them up and do it before you stretch. We'll get them loosened up so they stretch better. And with this muscle group, there's a lot of muscle mass there for a lot of people, especially if you're larger. You can go to a larger gun. We have our Bob and Brad
C2 Pro.
C2 Pro, and this actually has a head. Can you show them that head? This head is very unique, and there aren't many out there, but it actually heats up and it cools down. So whichever you respond better to, you can use that, or you can use both hot for a while, then cold, and do a contrast massage. It really works out well. Mike, can you talk about where to do it and then where not to do it to get the hip flexors?
Now, it's going to depend upon where you are tight in your legs. The hip flexors, you can kind of work laterally here in this region. You don't want to get too close to the groin region at all. There's a lot of different things that can happen in there, including lymphatic system, lymph nodes you don't want to hit. So just massage that area. If you're more sore in the quad region from your hips, you can certainly do there. Personally, I really like this on the hammies because my hammies are always tight. So any area that connects to the hip is a good place to massage.
Right. And again, that rectus femoris goes all the way up and down, so you can hit that with it. That's a really nice way to use a massage gun for this type of thing.
I would say different positions too. I get a little more feeling and go deeper if I'm standing up versus sitting down. So sometimes it's something to try as well.
Right. And we also got another video. If this is not getting the information you want, we also have on how to stop hip bursitis pain without seeing a doctor and having an injection for it.
So just click the video link on the screen if you want to check out that video.
There you go. Enjoy the day.
Taking this thing home.
Good hip health to you.